Hello everyone, welcome back to our channel. This is Terry. I am a health educator from Curry Senior Center. Today I want to talk about nutrition in aging part 1. In this video, I will give you a general guidelines on nutrition needs for older adults. So, proper nutrition is really important. No matter what your age, it gives you energy and can help you control your weight. It may also help prevent some diseases such as high blood pressure, heart diseases, type 2 diabetes, and certain cancers. Malnutrition and underweight is more common and severe in older adults compared to younger people. It might also increase nutrition risk. So let's go through some changes associated with older adults. As you aged, you might realize your body is acting differently. You might experience with some physical changes, social changes, and emotional changes. First of all, you might experience hunger, poverty, low food diet, and nutrient intake due to some illnesses and changes in how the body processes nutrients. You might have poor oral health, loss of teeth, and also acute or chronic disease. You might also experience with loss of appetite, diminished sense of taste and smell, eating disorder. These can be due to changes to the digestive system, hormonal changes, pain and decreased need for energy. Sometimes you might have physical discomfort and functional disabilities. Besides all the physical changes, older adults are also experiencing with some social and emotional changes. Depression, anxiety, loneliness, social isolation, and economic hardship. So nutrition is also really important for mental health. Certain nutrients and dietary patterns are linked to changes in the brain protein that can helps increase the connection between the brain cells. This brings up the main point of this video. I will introduce you with some nutrition and daily diet recommendations in the next few seconds. However, it is extremely important to keep that in mind that everybody's body composition, metabolism, and digestion system are all different. It is always the best to check with your healthcare provider for more detailed information. So the first one is energy requirements. As you age, you will have some changes in body composition, a decrease in lean body tissues, muscles, and increase in fat tissues. This means that older adults tend to have less muscles and more fats, leading to a decrease in energy requirements compared to younger adults. I have listed up the differences in energy requirements between female and male, and also takes into considerations of your activity level. So for male, if your activity level is sedentary, the energy requirements are roughly around 1,880 kcal. So kcal is a unit stand for calories. And then if your activity level is moderately active, then your energy requirements is around 2,200 calories. For female, if your activity level is sedentary and the energy requirement is roughly around 1,770 calories. If you are moderately active, then it's around 2,000 calories. Protein requirements. So how much protein intake is really depends on how much your body weighs. Roughly, it is around 50 to 65 grams of protein daily, but more accurate range still depends on your body weight. As previously mentioned, as you age, you might decrease in lean body tissues and muscles, so that you need a protein balanced diet to help to counteract it. Because of the muscle loss, older adults require more protein than younger adults. Food that has enriched protein is food with the milk, cheese, and other dairy products. Add nuts and seeds to your cereal. Load up on nut butters and protein shakes occasionally. The next is fluid intake requirement. As you age, total body water also decreases, so it is also really important to keep yourself hydrated. It is good to make sure that you drink 6 glasses of fluids per day. Even drinking tea will help, so keep water close by at all times. Fiber requirements. Fiber is important because it leads to lower cholesterol, control blood sugar levels, and normalize your bowel movement. And it can also help to maintain a healthy weight. Every day it is good to have 21 to 30 grams of dietary fiber. The food sources are included in whole grain bread, pasta, nuts, brown rice, and fruits and vegetables. So most of the food, they have their own fat in it. It doesn't mean that we cannot eat food that with the fat, but what we can do is to focus on food that has healthy fat. So healthy fats are good for your heart, your cholesterol level, and overall health. Healthy fat food sources are included with fatty fish, whole eggs, avocado, nuts, olive oil, chia seeds. So for nutrient supplements, needs to check with your healthcare provider and see if you need it. But most of the people take nutrient supplement only when they are lack of appetite, or if they have GI tract disease, poor diet, food insecurity, or they are taking medication that affect the nutrient absorption and metabolism. So always to check with your healthcare provider before adding any supplement into your nutrition or in your diet. So for caffeine intake, I believe that most of the people loves coffee or tea. As you age, you might become more sensitive to the effect that the caffeine has on our body. So moderate caffeine intake is okay, but high intake is not recommended. So you can take around 1 cup of the coffee or tea every day. Exercise activity recommendations. So resistance exercise include squats, lunges, and shoulder presses, etc. So you can do this resistance or weight bearing exercise for around 2 to 3 times a week. And how many sets, it depends on yourself. It depends on how comfortable you are. Aerobic exercise including walking, dancing, jogging, and even bicycle riding, etc. So you can do the aerobic exercise around 30 minutes per day. As long as you don't overdo yourself and always remember safety first. So it has come to the end in this video. So thank you so much for your time for watching it. If you have any questions, feel free to contact me. My email address is tli@curryseniorcenter.org. Thank you so much. Bye-bye.